So one of the articles in this week's reading really talked about what EHR is. And EHR stands for Electronic Health Records, and it is a longitudinal collection of electronic health information from an individual to as big as populations. EHR is a system that was created to create the diagnosis and treatment plans for individuals and populations quicker and more efficient, because this system allows for an individual's data to be collected in one source, and for different providers, whether it be your primary care provider, your pharmacist, your laboratory, all can access those files, and together they can come up and see what solutions work for that individual and what treatment plans are best and what treatment plans do not work. And EHR is also used for long-term healthcare information storage, which is good because a lot of times you hear that a lot of data is lost in a lot of providers' information on that individual.
Two big concerns with EHRs are privacy and security. Luckily, the federal government placed the Health Insurance Portability and Accountability Act, which is a privacy rule that makes sure patients have rights over the health information. Some security measures that EHRs put in place are limited access control, such as passwords and PINs to limit access, data encryption to ensure only people using the system can read the data, and audit trails, which are records of who accessed a patient's information, what changes were made, and when they were made. There are also some disadvantages of using EHR, which are that it's costly. EHR systems are expensive to purchase and maintain. It's also time-consuming training an individual to learn how to use the system. And lastly, failures can interrupt or even increase the workflow.
Recently, the real industry have a lot of a problem with the EHR system. First of all, the different hospitals have the different format. For example, the Hope Memorial Hospital have the different format as the case aquarium. That causes a lot of inconvenience for the people who need to collect the data from the EHR system. And moreover, some hospitals can write the data into the EHR system that caused more difficulty for the people to recognize the data. And moreover, the EHR system have very awful HCR designs that cause the people are not able to quickly learn how to use the systems and cannot correctly make a response for the EHR systems.
Computerized provider order entry, or CPOE for short, are online electronic systems created to replace paper-based ordering forms in hospitals. The pros of this online format are that the systems become much more accessible, as users will be able to access them from anywhere. Users are also able to keep an accessible medical record in addition to reviewing orders or making changes to their drug orders as necessary. The cons of this format, however, is that it takes a lot of work for it to be worth it. Hospital workers have to ensure that the systems are up to date. With the addition of these features also comes the possibility of user error and confusion. And if users can't understand how to utilize the systems properly, then the CPOE will just be a step back from the current paper forms that hospitals are using today.
So how does CPOE and EHR interfere with patient-physician interaction? Technology can detract from the patient experience and create a domino effect. Since programs like EHR and CPOE requires healthcare providers to spend more time on the computer rather than face-to-face interactions, this can affect a patient not to return for their future appointments and leave for another physician that is perceived to be more patient-friendly. And technology should be a tool to enhance the patient experience and support care rather than undermine it. Communication is related to quality of care and is important for an organization to assess and improve the EHR and CPOE patient experience. And they can ask questions like, what are the patient's perceptions of EHR and CPOE? Do they make patient care processes smoother, or does patient engagement feel authentic?